bunions all my life. Finally, at the age of 28, I decided to do something about it.
My minimally invasive bunion procedure allows the patient also to maintain their range of motion. Another advantage, you almost end up with having no scar. And my patients usually get the same benefits, if not better, versus traditional bunion procedure.
I absolutely love shoes. I would love to wear these things to work. I just can't wear them because I had to be on my feet and they're uncomfortable. I'll look brand new because I can't really wear them.
For women, I think feet are so important. These women usually don't like to show their feet to anyone. Most of them are very ashamed.
It's so unattractive. It's not worth the pain or the insecurity all day. So I will go back to my sneakers.
Having bunion deformities not only affects the foot, but it can affect the ankle, knee, and hip.
Pain has just gotten progressively worse. It feels like a handicap, for sure. I can actually feel it in my back. It does affect my hips, the way I walk, even if I'm in flat shoes. See, like all this, when your feet hurt, is horrible. Being on my feet all the time, up and down rough terrain, back and forth to the feed shed, back and forth to get hay. A lot of people depend on me and depend that I'm physically strong.
Bunion deformity is so common. 1 out of 5 women has a bunion deformity, whether it's mild, moderate, or severe.
As a woman, your feet literally something you show off. My femininity has been at a halt. I have this big passion that I love and I can't share because I'm worried that I hit the stage, everyone's gonna look at my foot. I'm personally embarrassed to perform. Pole often comes with a stigma, and it is an art form. Everyone has their different style, and it empowers a lot of women and empowers a lot of males who do it. Here you'll see how narrow this is. And my feet end up being swollen because I literally am losing circulation. Friction causes my bunion to shoot through. This one hurts really bad. Every single day, I'm reminded of how much I hate my feet. I've always been aware of my options. I haven't had it fixed for several reasons, the main one being the recovery time. I saw a specialist. I was looking still at least 4 months of completely being off my feet. And pain, from what I understand, a regular bunionectomy is extremely painful, and I'm already in enough pain. And then there's really the whole boot issue. I know it sounds extremely vain, but especially since both feet have bunions, the idea of being in 2 big boots, with as much as I have going on with working 2 jobs, a ranch, especially with how big my bunion is, I knew that the scar was gonna be huge. It wasn't an option for me. In my search of finding an alternative for a normal bunionectomy, I went on YouTube and found Dr. Khosroabadi on The Doctors, and from there that led me to his website, and I got caught up reading all the testimonials, watching how the procedure was done. I went through so many pictures specifically for the type of surgery that Dr. K does, and I was wildly impressed. Another reason, his procedure, with it being less invasive, less risk for complication, especially in recovery time, knowing that it's not like my feet are broken, which essentially is what's happening in the other surgeries.
Most of my patients, including Cheseray, are able to put weight on their feet the next day.
Also was this magical no scar procedures. I can be in normal shoes, which is absolutely amazing. It's definitely more than just a surgery. It's a life-changing event for me.
When Cheseray had her consultation with me, what I have recently acquired is this three-dimensional standing CT scan. Within a few minutes, you'll be able to see the foot in any angle that you desire to. That is important because when the patient is standing, their pathology is showing a lot more. So if the patient is flat-footed or high arch, you'll be able to pick up on those pathologies. With a standing CT scan, it's something that is very new. Not a lot of facilities have it. In the past, what we would do, we would take x-rays, multiple x-rays, and then also combine that with our physical examination and a gait examination. And that was dependent on the physician who was diagnosing it. So every physician could be diagnosing the patient slightly different. Whereas now, with a 5-minute scan, I'm able to pick up all the information that I need. All right, so I'm gonna show you the 3D remodeling information. So
Yeah, it's actually amazing.
3D dimension, yeah, 3D dimension.
Incredible that I can see all of this through the x-ray machine we just used, because I've only ever been able to see my foot in a regular x-ray. Yeah.
This is a very advanced technology, and I'm able to go on the bottom of the foot and see the relationship between the bones. The first metatarsal, the first bone, is severely deviated from the second metatarsal. Right foot, a little less. Left untreated, it's gonna be just like the left foot. I diagnosed her with a left severe bunion, and right foot was moderate. If you don't treat the bunion, this toe will eventually start hammering, and you're gonna end up having a hammer toe on the side.
No, can't have that.
I know. This one is also starting to go under. So the good news is we're gonna be able to do both of your bunions through this bunion procedure.
Excellent.
Okay. Traditional bunion surgery normally takes about an hour and 15 minutes. My procedure usually takes about 15, maximum 20 minutes. That's just equivalent to a lunch break. Patients usually get the same benefits, if not better, even on severe bunions. So I started Chesaray's surgery by operating on the right foot. Almost all my surgeries are done under live x-ray. The reason I use this device is because I'm not opening the foot, because the incisions are so small, I'm not able to see the bone. I want to make sure I'm in the right spot with the blade. And that's where I usually make my incision. So this is about as big as the incision that I make, and everything gets done through the same incision, about 1 centimeter. These incisions are so small that when they heal, you almost end up with having no scar. The way I cut my bone is using a wire to make drill holes, and then use an osteotome, which is a chisel, to cut the bones. I don't use any saw. Cut the bone. It's called the multiple drill hole technique. So because I use this technique with a wire and a chisel, and not using a traditional saw, patients recover a lot faster and have less pain and less swelling. You can see how the bone was cut nicely. Less trauma to the bone, less heat created, and minimal invasive. Because of long-standing bunion, she has a very tight tendon on this side. I'm deciding to release that, and that's an easy way to ensure that her bunion won't come back. I also use a small wire and a small screw to hold the bone in the position till it completely heals. So now her big toe is able to go up and down in it. And now these two bones will grow together along that rod. Her bunion is gone and the toe is nice and straight. Cheseray had a more severe bunion on the left than the right. The shift was a lot more significant on the left, but essentially the technique and the fixation was very similar. Here we go. So now the alignment is nice and straight. Bye-bye bunion. Her bunion was so severe. If she was to have the traditional bunion surgery, they would have never been able to shift this bone as much. 10 minutes ago, we started with a very severe bunion, and as you can see, The toe is nice and straight. The success rate of my minimally invasive bunion procedure is very similar, if not better, than a traditional bunion surgery. I want to put it in the 90th percentile. Dancers and athletes, runners, patients who exercise religiously are the perfect candidate for this procedure. Cheseray came to see me about a year later for her annual checkup. She was doing very well. Oh my God, look, you're wearing your nice shoes now.
My feet actually fit in heels now.
Awesome.
I can teach in my shoes again now and no pain. The day after, I was surprised by how little pain I actually was in. I was only on my pain meds the first day and half of the second day. I don't feel tight in the hips anymore.
She had started getting back to all her activities.
I didn't have to wear a big clunky boot. I didn't need crutches. I was able to go back to work without any limitations.
She had no restrictions. Her range of motion remained intact, more stability on her feet. The scar from the surgery is almost non-visible. Before and after, the left foot was worse. As you can see, your first metatarsal was starting to deviate from your second metatarsal, and the joint was jackknifing, and that's exactly how a bunion gets developed. This was during the healing process. The bone healing was not apparent as of yet. Just a few months later, hardware was removed. You can see bone healing, and now you can see the alignment is great.
It's even cool to see that the other toes are straighter. Like these toes were starting to curl over.
Yeah, it looks really good. She couldn't be happier with the procedure and having amazing results, and that's exactly what she had.
This is definitely the greatest I've ever felt. I go get pedicures. I also have tan lines from my flip-flops. I've been flip-flops so much now. And now that I can show my feet, nothing my feet can't handle anymore. I just feel like a whole woman. Since my last checkup, the scars have definitely gone down. I would never know that I had bunions. When I get excited, what I can wear isn't limited anymore. I spent so much time buying shoes in hopes and in anticipation that one day I would wear them. And this is just the beginning of my stiletto collection now. This freedom that I've never, ever, ever had. Since surgery, I've been able to spend more time in the gym because I'm not in pain. I teach more classes now. Before, I would really only teach 2 to 3 classes a week. Now, I'm steady teaching 7 classes a week. I'm still here at the ranch. You can see all these hills. Just that would be difficult and painful. I can do it now comfortably and all day, essentially, and enjoy just this beautiful setting. All right, relax. I don't know where I would be right now without Dr. K. I cannot thank him enough for this gift of a new life. Not just new feet, but a gift of a new life. I'm free, I can do whatever I want now. Look at my feet.